Thank you so much to all our eminent doctors, our speakers, for really enriching us with all this pertinent knowledge. We can see that the audience is very, very engaged, and we thank Bhagwan Yogi Ramsuratkumar again for orchestrating such a beautiful session for all of us. Next, we have a technical talk by none other than Dr. Girija. She is a name that really needs no introduction. Ma'am, we are so honored to have you here with us today. But protocol demands that we attempt to share a small introduction about her. Again, all of the speakers that I've tried to introduce, I honestly cannot do justice to their achievements. While I'm sitting through the seminar, I keep pinching myself, asking myself, what have I done to deserve to sit in the same room as some of the brightest minds in the country today? So a big, big thank you to Bhagwan and all the organizers for bringing all of them into the same space as us and allowing all of us to be illuminated by their knowledge. Dr. PLT Girija is an eminent Vaidya in the field of Ayurvedic medicine. She has a rich academic background. She holds an MPhil degree in sociology from JNU Delhi and a BAMS degree from the esteemed Venkatramana Ayurveda College in Chennai. Guided by revered Ayurveda Acharyas of Chennai, she founded Sanjeevani, a healthcare center in 1990, driven by her profound belief in the comprehensive efficacy of Ayurveda to address the healthcare needs of our society. She played a pivotal role in training. This is just one of her many, many achievements. She played a pivotal role in training approximately 2,500 village health nurses in maternal and child health, utilizing Ayurvedic practices. She developed a kit containing 50 drugs consisting of Ayurveda and Siddha medicines, along with the manuals to properly train them. Leading a dynamic team of young Ayurvedic doctors, she continues to make a significant impact. She serves as a consultant to the Tamil Nadu government in their health system development project. Doctor, we are so honored to have you here with us. We request you to please deliver your technical talk for today.
A big namaskaram to each and every one of you. Mataji, my namaskaram to each and every one of you, Mataji and the organizers. I would straight away start my topic, which is efficacy of Ayurveda in treating public health issues. Here I take two major issues. One is how Ayurveda treated COVID-19 and particularly the high-risk cases. And then how short-term interventions to tackle malnutrition and anemia. Professor Rama dealt with a lot of concepts in Ayurveda. I think I should try and see how these concepts are applied in practice. Just the main point at the outset, it must be said that public health dominated solely by modern Western medicine had no treatment for COVID-19. State also failed to explore and utilize the competence and efficacy of Ayurveda in treating COVID-19. Nevertheless, Ayurveda diagnosed and treated effectively a new disease and a pandemic. We would have treated close to 1,000 people. In Tamil we say Sutramum Natpum. Everybody who knew Ayurvedic people were taking medicines. But this data is based on 781 documented cases of patients of COVID-19 at our Adayar clinic. It was a standalone Ayurvedic treatment. It treated mild cases, moderate and severe cases. And it treated patients with multiple comorbidities and high-risk patients, and all patients were treated safely and effectively. Now, what is meant by comorbidities? The following are the diseases which are considered comorbid condition in COVID-19 and which are supposed to have a poor outcome. One of them is right on top is diabetes, hypertension, cancer, coronary artery disease, chronic kidney disease, chronic obstructive pulmonary disease, immune compromise state or a weak immune system, moderate to severe asthma, obesity which is above 30 BMI, and then those who are above 60 years of age. Now, in our 781 cases, all the above mentioned high-risk patients were present. Those with multiple comorbidities. Multiple comorbidities means one doesn't have only one disease. He'll be hypertensive, there'll be diabetes, and other combinations would be there. So there will be a single patient with multiple comorbidities, patients with low oxygen saturation, young and old. The youngest was 1 year old, the oldest was 94 years old. Now, we didn't start by just treating COVID as though we had a medicine right away. It was as early as end of February 2020 that one of our devoted patients contracted COVID. While treating him with Ayurvedic medicine, we realized it was Vata Kapha Jwara, because there are so many types of Jwara. We had to diagnose what type of Jwara it is. Thereafter, the treatment becomes easy. So the diagnosis of Vata Kapha Jwara was dependent on the typical symptom it presented. Now, if I take two texts, one will say Tapahani, Aruchi, Shiroruk, Pinasa, Shosana, Kasa, Vibandaha, Shita, Jadya, Timira, Brahma, Tandraha, Sleshma, Vata, Janita, Jwaralingam. The other one says Shitako, Gauravam, Tandra, Staimityam, Parvanam, Charuk, Shirograha, Pratishaya, Kasa, Sweda, Apravartanam, Santapo, Madhya Vegascha, Vata, Sleshma, Jaragrati. So, if you look at the symptoms of COVID, it fits into all this. Tapahani or Santapo Madhya Vegascha means it is not a type of fever which was like, we have seen fevers of 105, 106. But this had only something between 100, sometimes 99, maximum 102. It was between 100 and 102. Among all these, we had only 3 patients who had 104 fever. So it was a moderate kind of fever. It had all these symptoms, penasam, which is runny nose, cold, breathlessness, cough, shiroruk, headache, brahma, giddiness, all this klama, kasam, gauravam, tandra, all kinds of tiredness, whatever you can recollect from COVID-19, all of them are listed here. So it was a typically Vata Kapha Jwara, and once the Vata Kapha Jwara is understood, the treatment becomes easy. We started with the case record form, which was originally provided by the Ayush department. We had to enter the demographic information, chief complaints, travel history of the patient, contact history, date of onset and vital signs, comorbidities, medication history, Ayurvedic examination and diagnosis, assessment, clinical symptoms, adverse effect if any, consent, because the patient has to give consent for Ayurvedic treatment, recording of daily progress. This consisted of the case record form. Then we had to give a treatment protocol. The treatment protocol had criteria there are some included, some excluded. The included ones are those who were willing to be treated purely and only by Ayurveda. Those who wanted to combine modern Western medicine and Ayurveda were excluded. Another criteria was they should be willing to be treated under home quarantine. And those who wanted hospitalization had to be turned down. Then home quarantine prescribed a certain diet and medicine. We had a number of dropouts based on just not able to adhere to diet. They say, because they are not used to regulating diet in fevers. So that was also one of the conditions. Then patient had to self-monitor. They are not used to self-monitoring their conditions, so they had to self-monitor and decide how they felt, whether they had cough, whether they had breathlessness, how was the fever, did they pass motion. So all this had to be self-monitored. Ayurveda Vaidyas would daily call them on the telephone. They were assessed on several parameters: fever, appetite, body pain, urine, motion, bowel movement, cough, breathlessness, general orientation, any new symptom, signs of remission. All these were the ones. Our doctors were on phone calling some patients multiple times a day, because some of them were worried about their conditions, some of them were thinking when we had no life support system, so whether they would have to go to a hospital. Some of them would read their oxygen saturation level and pulse differently. So suddenly they will say, my oxygen is dropped to 50, 60, but they would show no symptoms, then we would have to correct it. So there were all kinds of confusion and they self-monitored their condition. Then kept track of all necessary vital parameters till either a negative RT-PCR test or full resolution of symptoms. Thereafter, we were prescribed Rasayana medicines for post-recovery. We made a basic drug kit. This is not the entire drug kit, but we made a basic one because there were mild cases, moderate cases, severe cases. So this is somewhat, some basic drugs were put together for an average patient, and we use different medicines in different situations. There were 3 COVID waves. First wave was 337 we treated. Second wave 322. The second wave we could not handle, so it was more than what we could handle, so we had to refer the patients to other Vaidyas. And the third wave 122. Now I'll start with my very first. The very first COVID patient was the one I mentioned earlier, but actually this was the first patient that we handled, and it was a very high-risk patient. It so happened everybody in Chennai and around will know the grand old diabetologist, Dr. C.V. Krishnaswamy. Dr. C.V.K. used to work very closely with us. And he called and said, Girija, I'm going to hand you over a patient of mine. If I send her to a hospital, she will not survive. I would much rather that she's treated with Ayurveda. We were very happy. We were getting our very first patient because, as you know, that Government of India, state governments, they all said Ayurvedic people should not handle or touch COVID patients. So we were very happy and we were prepared to treat. We decided that no matter what the governments are saying, if patients come to us, we are here to treat them. So we were happy, and our happiness was short-lived because when we went through the case, we realized it was a very, very high-risk patient. She was 57 years old, female patient, type 2 diabetes mellitus since 1987. She was hypertensive since 1998. She had coronary artery disease since 2015. She had chronic kidney disease since 2013. She had chronic obstructive pulmonary disease since 2014. She had a breast lesion since 2019. She was maintained on hemodialysis, that is what they call percutaneous catheterization of internal jugular vein, 3 times a week. Unless every week she had to undergo this hemodialysis 3 times. And so we realized that this is not going to be easy for us. So we looked at her symptoms. She had cough, fever, loose stools, nausea, and a week prior to this she had received allopathic treatment for cough and had completed a course of antibiotic with no relief. That is when they realized that she could be having COVID. And then she tested COVID positive and she was referred to us. So we started with the minimum medication, which is basically Sudarshana Churnam, then Amalaki, Vibhitaki, Haritaki with Pippali, Dhanvantara Guttika and Kudajarishtam. And 2 days later, we added one more medication for fever. In 3 days, fever touched normal, no body pain felt, and she felt quite fresh. There was mild cough present, loose stools persisted, and she had completed 9 days of treatment. Now, in the meantime, she had missed 3 hemodialysis, and there was no hospital in Chennai who would take on a COVID patient for hemodialysis. So Dr. CVK told me he tried 85 hospitals and all of them turned it down, and finally he found one hospital which was willing to take her on. So they took her for hemodialysis, and at that time they did a blood test and they found all vital parameters as per modern Western medicines were normal. There was no lung involvement, CXR PA view clear, routine baseline investigation showed elevated renal parameters, but serum potassium and bicarbonate levels were maintained within normal range despite missing 3 consecutive dialysis procedures. On 14th day after the admission, on the 14th day, she was there for 3 days, 4 days, and at the time of discharge, her COVID PCR test was negative, and Dr. CVK said this was possible only because of the protective nature of Ayurvedic medicine. And Dr. CVK wrote an article in the medical journal on this case. There were many other high-risk cases. There were lung cancer patients on palliative chemotherapy, cancer patient undergoing radiation, patients with low SpO2, elderly with multiple comorbidities, elderly diabetic and hypertensive with a long history of chronic cardiac disease, recovering from recent heart attack, 92-year-old with multiple comorbidities, patient in an ICU, and a patient rapidly deteriorating on steroid and blood thinner. The request came from an allopathic doctor and we could handle it. Now, some of the details you would find it in our journal article, but I will read out a few. Several cancer patients we treated. There was a male with a lung cancer undergoing palliative chemotherapy. He was referred to us by his treating oncologist from, I think, Ramachandra, and he was safely treated. Then there was a female patient undergoing radiation therapy, post-mastectomy and chemotherapy, and you can imagine her immune system would have been highly compromised. She was hypertensive for 10 years and diabetic for an equal number of years. She could resume her radiation therapy after getting cured of COVID-19. There were patients with low SpO2 levels, a 65-year-old male patient with type 2 diabetes and anemia, with aortic valve sclerosis with diastolic dysfunction, fatty liver and hypoproteinemia. He had an elevated CRP of 28, the normal is supposed to be 5, and a CT feature suggestive of acute viral interstitial pneumonitis with a lung involvement of 50 to 55%. His oxygen saturation was 79. He had already undergone allopathic treatment for 9 days, which he did not tell us, and he came as a fresh case to us. If we had known, perhaps we may not have taken it, but he made a safe recovery. Then there was an 80-year-old with chronic obstructive pulmonary disease for 2 years with an SpO2 of 76%, made good recovery. 63-year-old female diabetic patient who was obese, breathless, blood-streaked sputum, loose stools and fever with an SpO2 of 75, and if she walks to the restroom, she said it dropped to 60s. And she made a good recovery. Then in this particular case, they tried using an oxygen concentrator, and the oxygen concentrator, when they tried, the levels went up from 75 to 77%, not beyond that. Then there was a wheelchair-bound 87-year-old female with a long history of chronic cardiac disease, and recently had a heart attack, and diabetic and hypertensive. She made an uneventful recovery. A 92-year-old male who was hypertensive with a coronary artery bypass grafting for CAD with a history of TB and a recent burn injury, who was on a permanent urinary catheter and who was treated safely with Ayurvedic medicine. So you can see a number of high-risk cases were very safely treated, and these, for the high-risk cases, if the oxygen levels are very low, now we didn't go by the oxygen levels, but nevertheless, whether you like it or not, the patient will educate you what is every morning, the first thing they'll say, my oxygen level is this. Anyway, we would look for whether there is breathlessness. If there is Shwasam and a condition which is more acute, then we would use a different set of medicine which will be primarily aimed at relieving the acute respiratory condition. This is one of the combination where we put together Madhyashti, Sitophala, Sringabasmam, Abragam, Shwaskutaras, Makarandwajam, and Lagusut Sekaras, Anupan. Like this, we had several Hemagarbha Potali, Malagarbha Potali. There were many other rasa drugs which were very effectively used in acute cases. Now, if you look at, if I highlight the Ayurvedic treatment, there was no deterioration of patients under Ayurvedic treatment. Quick resolution of symptoms. This is, I think, is the best part of Ayurvedic treatment. Whether they are comorbid conditions or whether they are mild or moderate or severe, children or old, plus minus 6 days, resolution of symptom happened. Ayurvedic medicines were found to be safe, whether they are herbal, metallic, mineral, whatever. The entire treatment cost was a minuscule. I mean, you know how much people spent. This was hardly any cost for them. And the mortality was very low. We had 3 cases of mortality. One was a patient, an outstation patient, where the medicine reached him in the evening. Then the next morning when we had called, he had already passed away. He had had 1 dose of our medicine. The next morning he might have had 1 more dose. He really didn't take Ayurvedic treatment, but nevertheless we had to record it as 1 fatality. The second case was we had to take him on, I would say humanitarian, or he was a bedridden patient of dementia, and no hospital would admit him. And the son who was nursing the bedridden father sort of said, it doesn't matter whether my father survives or not, but please give him some medication. So we gave him medicine, but he did not survive. But what is interesting was the son called to thank us. He said, I was full-time nursing my father and I kept taking the same medicine and I did not contract COVID. The third case was double vaccinated, co-vaccine, double vaccinated. He was also having comorbidities, and he had already undergone 5 days of allopathic treatment and he was already on steroids. And he wanted, he was known to one of our doctors who was treating, so he was one more fatality that we faced. So there were 3 fatalities. Even this, I would say, if the government had allowed in-house treatment, maybe we could have saved 1 or 2 of them out of the 3. So there were, this is the mortality is concerned. Now the outcome measures, if you say sex-wise and female-male, 419 female, 362 male. BMI over 30 was 118. Age over 60, 184. Diabetes 124, hypertension 113, cancer 11, asthma 46, COPD 8, CKD 5. These were and those with the respiratory condition 594. Like that, these are the combinations. Then this is the symptomatic patients, and asymptomatic was a small 4% had asymptomatic, the rest were symptomatic and with comorbidities. Then the number of patients versus symptoms. The most common were weakness, fever, cough, sore throat, headache, diarrhea, nausea, vomiting, breathlessness, runny nose, confusion, and some of them had other symptoms. Now this is the recovery days. You would see recovery days plus minus 6. And the other one is age-wise comorbidities and risk factors. And age-wise recovery days. See, 0 to 10 and 90 to 100, they all average around 6. So the recovery days, the resolution of symptoms were very, very quick when handled with Ayurveda. Now, on a retrospective analysis, you can definitely say that Ayurvedic treatment for COVID-19 was safe and it was effective. It handled mild, moderate, severe, high-risk patients with great efficacy. Mild ones received minimum medication, and it arrested the progress of the disease. Severe cases received more intense care, and it effectively prevented the deterioration of their condition. Case of hypoxemia, that is SpO2 below 93 is considered hypoxemia, and you saw how low the levels were. And wherever there is severe cough and breathlessness, medication and dosage became muhur muhur, which means it's a particular dosaging pattern, which is in dosaging patients frequently. That is something like once in 1.5 hours. So during the day, we would give 10 doses of certain specific medication. And severe cases of COVID received many rasa drugs with no adverse effect. Those with SpO2 level in the 70s were well into an acute and progressive stage of the disease, indicating severe pulmonary pathology. Severe case with pneumonia required hospitalization with intensive care and respiratory support, but none of this was required for our patient. Despite poor diagnostic features, all those treated with Ayurvedic medication recovered fully. Now, in modern Western medicine, no treatment or prophylaxis was there, which could either protect or prevent this disease, or prevent the disease from progressing from an early age to a more advanced case. In fact, if you notice, the disease starts as a simple disease. Cough, cold, fever, then slowly you find it starts deteriorating because the total absence of any proper medication, it starts deteriorating. Zinc, vitamin C, antibiotics were of no consequence to this. Remdesivir, dexamethasone, not mandated for mild and moderate cases. High use of steroid and blood thinners led to post-COVID complications. Relying heavily on mechanical support system and self-limiting nature of COVID-19 resulted in high rate of mortality. Now, what is most interesting is there was no single universal medicine for COVID-19. The person in Kashmir or somewhere in UP could be using a set of medicines which is very different from what we may use in Chennai or in Kerala or somewhere. Kerala, of course, they were not allowed to treat COVID-19. In Tamil Nadu, they turned a diplomatic blind eye. They were very happy. They knew we were treating. They themselves gave Kapasura Kudineer, so it was a fine condition here in Tamil Nadu. So the beauty of Ayurveda is, once you know it is a Vata Kapha Jwara, then there are umpteen number of medicines you can use. It is depending on what is available for the Vaidya, what the Vaidya is familiar with, or what that particular person requires, you can change the medication and tweak it. Rasa drugs used were safe, effective, had no adverse effect on any patient. Quick resolution of symptom, as I told you earlier, was one of the high points. Low cost, low mortality, diagnose and treat a new disease with ease. And Ayurveda allowed to play a central role in COVID-19, we could have definitely reduced the mortality. So we were saying, how does one treat a new disease? Because this is some 5,000 years old, and how do we treat? So in our text as students, this is the sloka which really we learned, Vikara nama akushalo na jagihriyat kadachana. That is, nahi sarva vikaranam namatosi dhruvasthitihi. There are a lot of newer and newer diseases will come. You won't be able to name all of them. Sayeva kupito doshaha samuttana visheshataka sthanantarani cha prapya vikaran kurute bahonu tasmat vikara pragati adhishtana antarani cha buddhva hetu visheshamscha shikram kuryat upakramam. Once you find out what is the doshas that are involved, what is the dhatu which is affected, which is the seat of the disease, and what are the signs and symptoms of the disease, then you can understand the nature of the disease and the cause of the disease, and you find out all this and quickly get into Shikram Kuryat Upakramam, you give the treatment to the patient. So this is how any disease, even if it is a new one, that we are able to diagnose it. Now I come to the second part of the presentation, namely primary health care. Two of the major problems that we face in our practice, we found that India has got a huge burden of malnutrition, anemia, or malnutrition, or it's called undernutrition these days, and anemia. These are two of the major problems, and we did a short intervention to demonstrate how anemia and malnutrition can be abated if properly attended to. And the current healthcare policy, which pumps primary healthcare with whole lot of medication, just doesn't work. Of course, anemia is a national disease for us. It's a national calamity, I would say. It is the most debilitating disease among women, pregnant mothers and children. More than half of Indian women are anemic. 3/4 of Indian children are anemic. 3/4 of children under 5 years of age. It increases the risk of death and disease. 40% of the maternal deaths are associated to anemia and anemia-related complications. And this National Nutritional Anemia Prophylactic Program, which has been going on for 70 years, has made no impact, and it's been an utter failure. Similarly, malnutrition, high mortality, high morbidity, low birth weight. Our children born are not even 2.2 kg, is supposed to be some kind of a mark, and they are below birth weight, anemic, low resistant to diseases, poor stunted growth and development. Now 25% of all undernourished people supposed to be living in India. These are all official statistics. Over 1/3 of world's chronically stunted children is supposed to be living in India. 44% of the children in India are underweight. 75% of the children in India are anemic. And then this is the main cause is widespread malnutrition. So what we did initially was we thought we should have a short-term intervention which would take care of both these issues. And we found that for growing children, the best food is milk. If you notice, after breast milk, our poor children don't get any milk at all. And so for their growth and development, we chose milk, and we supplemented it with Ayurvedic medicines. And we chose two things. One is Ashwagandhadi Churnam, the other one is Lohabasmam. And Ashwagandhadi Churnam has clove, Nagakesaram, cardamom, pepper, long pepper, dry ginger, ashwagandha and sugar. and it is effective. The Falashruti is, it's effective in preventing and controlling fever, breathing difficulty, cough, cold, throat troubles, hiccup, aches and pains, wasting, improves digestion, improves appetite, improves anemic condition, stomach pain, good for heart and good for the spleen. So this was our choice, along with Loha Basmam. Loham is an iron, and iron was proportionately given depending on the age. It was given for 6 weeks at a time, at a stretch. Then we would discontinue that and reintroduce it after 6 months. So initially how we went about it, we prepared a questionnaire which would have all symptoms of anemia and malnutrition. So we would measure the weight, then ringing sound in the, many children complained of ringing sound in the ears. This is one of the symptoms of anemia. Ringing in the ears, loss of appetite, aversion to food, weakness, tiredness, giddiness, fever, breathlessness on climbing even one flight of stairs, feeling of heaviness, swelling around the eyes, changed skin tone, excessive hair fall, anger, dislike for cold things, sleepiness. In the classroom, they'll fall asleep. Sleepiness, cramps in the calf muscle, palpitation, headache, no desire to speak, pain in the back, pain in the leg, thighs, flanks, body ache, tremor, fainting, vomiting. The questionnaire contains all this, and each and every, we tried it out in many schools, and they are supposed to initially fill this questionnaire before they started the program. So some of the common symptoms we found among children were cramping pain in the legs, low weight, tiredness, lack of appetite, headache, underweight, repeated illness, frequent fever, cold, cough. This is very high, and poor resistance to diseases. So first 6 weeks, it was given once daily on an empty stomach, milk about 200 ml, ashwagandha about 3 grams, loha basmam appropriate dose. Then the rest is 6 weeks. After that we discontinue loha and continue the milk and ashwagandha. And families were advised to reduce salt, sour and spicy food in their diet. Whether they follow it or not, we say it. But they are in no position to change their diet majorly. This is the questionnaire from one of the schools. This is how they fill it up. And this was tried out across several states. I must say that we tried out a number of states, and it was helped by a number of people. Many individuals contributed to this program. Many groups contributed. Many trusts contributed, and so many people took it on in their own respective areas, and we could anchor it in many places. And this was, I think, this is in Jharkhand, and the observation generally within a month changes were noticed. First thing they said, they stopped falling sick. Repeated visit to the doctors stopped. In fact, one of the schools, they were regularly taking, every day 4-5 students used to be taken to the local government hospital. After some time, when it all stopped, the doctors started asking, why have you all started going to some other hospital? Then stopped complaints such as loss of appetite, leg pain, cough, cold, fever. Better growth and development were noticed. The teachers said their attendance went up in school because their children no longer fall sick and they all end up going to school. Many of them love to drink this milk, they wait for it. And cost, if you look at it, we did many surveys. One of the things is the number of times they fall sick, how much they spend on doctors and medicine, and what is the cost of the milk and ashwagandha churnam that we were giving. So the cost of both were roughly the same. They were spending something like 300 rupees a month, I think, between doctors and everything. And for a child with the 300 rupees, we could give them better health and better resistance with milk. This is where we started first, Palaguttapalle. I must say the credit of anchoring this program across several states goes entirely to our colleague Aparna ji. Aparna is very, very active, and but for her, I don't think we could have done this. And it started in this place called Palaguttapalli, and it had a rippling effect. Palaguttapalli, what happened was, there was a group around Aparna who wanted to do something for the poor people, and as an intervention, they tried initially some sprouts, then they tried some sundal and boiled pulses, and because some protein intake they felt was necessary, and they tried it for almost a year, and there was no substantial difference. Then only I advised Aparna that you start this Jeevani program, call it Jeevani, but this milk and the supplements, and see how it works. Before the intervention, the child would fall ill about twice a month. The parents were spending around 300 per child. After the intervention, most of the children had not fallen ill even once. And over the year, there were only 4 cases of fevers and 4 cases of cold among 35 children in one particular school. There was substantial improvement in health, appetite, weight, and alertness. Children stopped falling sick, need for a doctor's visit drastically reduced, and okay. Now we started getting letters of appreciation from the school headmasters, school teachers. This is a bordering area between Tamil Nadu and Andhra, so they write in Telugu and send this letter. This is Denapeta, another place. Then this is a SC Hamlet, and the questionnaire filled, etc. It was fine. Then this is some Kavatigaripalli. There again the request came, and then we started this project. Then there was a letter from the teacher of that place saying how well the children are after starting this. Then after 6 weeks, another letter. Then another letter from a teacher on the well-being of their student. Then there is Kottapeta, some children in the school. It started in December 2018. But during the COVID, we had a break. But in these areas, the break was very short and restarted again. Some of the other areas in Chennai, it had to be discontinued because of COVID. Then this was a requisition letter. Now every nearby school started requesting us to give this this Jeevani program in their school. So like this, we started getting several requisition letters, record details. This is the Vardapanaidupeta school. Kondapalli school teachers requested, they also wanted the same thing. Then this is Kondapalli, then this is Kottapeta, then the letter from the teacher of the well-being of the children. Then this is Krishnapuram, and then Kommireddy Garipalli school, request letter. So there were number of these. First day, I wanted to show you, this is Aparnaji on the extreme left. She is the one who's been handling this. Kamalapuram, that is the last which came as a request. And this is in Jharkhand, and you should read the Jharkhand letter. The request, the result of Ashwagandhadi has been simply amazing. These children were very vulnerable. They are all tribal children. They are vulnerable to frequent viral fevers and cough and cold. 4 of them were also highly susceptible to acute and protracted congestion of the chest. After administering Jeevani program, this winter there has not been a single instance of viral fever. There has not been a single case of cough, cold and chest congestion. There is no snort visible. This was a regular problem with 3 children. The children look more healthy. There is a glaze in their face. They seem more active. Amazing. Now, this is from Port Blair. One of, again, our patients handled this. And the school wrote saying, they have a medical checkup and it was observed that their hemoglobin had improved great extent. Moreover, the children are extremely energetic and they have participated in annual sports and 27 of them have won prizes, which is a record. I believe that they have gained enough energy after taking the medicine. As you know, we are absolutely vegetarian. This medicine is adding extra diet to their food. So, now there are other places in Tamil Nadu, Tirukovilur, and then there has been quite a bit of coverage of this. This is a Tamil newspaper. Then there is a letter, this is a letter from a principal of a school. How well, now it's in Tamil. And it says the same thing, how during rainy season their dormitory used to be children lying down all the time with fever, talavali, kachal, body pain, and he says after starting this program there's been none of this. This is Away Home, which was discontinued during COVID. This is Santoshpuram, also discontinued during COVID. This is again Santoshpuram, and this is covered in Down to Earth, another environment magazine about this. And this came in Agricultural World. Now, the idea is, it is not that we can sort the problem of anemia or malnutrition. This is only to have a demonstrative effect so that the policy makers and the bureaucrats and the governments take note of it and start these programs so that a short-term intervention can give them a huge boost. Otherwise, are we going to remain malnourished, anemic for generations and wait for next 2 generations to improve our condition? So that is not the way we go about it. So a short-term intervention is absolutely essential, and you find that primary health care, medication is not required at all. You take care of the health of the children. Now, you will get more details on this website. And Jeevani Milgram currently is on various places, some are not there. And before I end, one last thing. You see, this is our health budget. 97% of the health budget goes to modern Western medicine and 3% goes to Indian systems of medicine. And this 3%, 1.5% comes to Ayurveda. This is the state of affairs in this country, and if we have to make any change, I think they simply have to mainstream Ayurveda and increase the budget hugely. Thank you very much. How do you take this out? Can you help me? Just pull it out. It doesn't have to. Is it okay?
Yogi Ramsuratkumar, thank you so much, Doctor. We're going to open the floor for maybe we have time for 2 questions. We don't, yes. Can you please pass the mic to Dr. Ramanathan, please? We'll be breaking for lunch immediately after this, so we have time for maximum 2 questions. Yogi Ramsuratkumar, Jai Guru Raya.
Thank you very much, madam, for this beautiful presentation. My question is, actually 2 questions are there. I'll try to be very brief. 100 years back, we had Spanish flu. So do we have any documentation of how the Ayurvedic, because the Usman committee had just formed a few years before that. Around 1916, the Usman committee had formed, and by then there was a lot of hue and cry about Ayurvedic thing in the country. So in 1920 and 21, when we were grappling with Spanish flu, today do we have any record per se on how the Ayurvedic physicians back then dealt with the viral attack during that time? And secondly, through this Jeevani program, because all along we hear that it's always a host response, that is individual's host that is to be looked at, and not something like a panacea which will work for the entire mass. But through your Jeevani program, you are trying to actually challenge that and also saying there are panacea which could work for large masses. So is there something new in the direction of Ayurveda, or how to reconcile this with the individual host response? Thank you.
The Spanish flu, I'm not aware of any major write-up. Here and there I have seen some Ayurvedic inputs, but I'm not aware. Maybe because I have not looked into it. The other thing is, here the major thing is milk. Milk is universal, ajanma satmyam. And when we do the initial questionnaire, we sort of pick out some. So some of them may have a skin disease, for instance, and some of them may have something else. So we isolate them and treat them and then put them onto this. And iron supplement, I think, is for a short period, it is done well. It can be given universally. Now this very aggressively they peddle this anemia, National Nutritional Anemia Program. In fact, it is causing problems in many people, but they are still going on with it, knowing very well it has not worked. Whereas our short-term iron supplements have not caused any problem.
I must really actually congratulate you on this, such a great feat actually. Just take 30 seconds more. This is not a question, but it's just a comment that when I read or when I heard Dr. Vijayalakshmi Ravindranath, former founding director of Brain Research Institute, she's from IISc, she said that people, girls especially, if they're anemic, before even before they become adult, if they're anemic for even few years, once they become adult, their fetus is unable to conceive their uterus is unable to conceive a healthy fetus. So anemic things in girls are having impact after 10-15 years also on them. So in that case, kudos to you, ma'am, that you're battling this, taking it right, the bull on its horn, and seeing success on it. Thank you very much, ma'am.
Thank you.
A normal question. Actually, these herbal products are being manufactured from the herbal plants. Are there any challenges in identifying the herbal plants, and production of the herbal plants can be increased? What measures are being now taken to improve that?
Nothing much has been done in terms of increasing the production. Many of them are getting more and more extinct. In fact, a typical medicine that we used, Sudarshan, for this COVID, one of the most common medicine, it was there in every prescription. The major drug is Kiratatiktam, but there were 24 drugs, one major drug, 24 parts, the rest are all one part. That was a substitute that was being used, Nelavembu. Nelavembu is not Kiratatiktam. It is also effective in fevers. So like that, there are so many important drugs in Ayurveda, which are, it is on the verge of extinction, but not much effort has been done. So because they don't take Ayurvedic medicine as an important system of medicine, otherwise why would they allocate only 1.5% to it or 3% to all put together? The other question you asked was identification. Yeah, there is problem. We need to depend on people who are well versed in identifying plants. We have to rely on them. Thank you, sir.
Thank you.
Thank you.
Yogi Ramsuratkumar, Jaya Guru Raya. Thank you, Dr. Girija, for a very beautiful and enlightening session. We now request Ma Devaki of the Yogi Ramsuratkumar Ashram to please honor Dr. Girija. We request our volunteers to kindly do the needful.